Back pain is the #1 medical diagnosis for cannabis use in the US. Today, we're going to break down that particular type of pain and why cannabis is helping patients get off of opioids. Welcome back to Discover Marijuana, where we're talking a lot about back pain today and pain in general. We've done a lot of videos on pain. In fact, we've done videos on opioid reduction with Josh in season 2. We've done some product recommendations around pain, but I'd like to focus today on back pain. 75% of chronic pain patients in the US report having back pain. It's really the most common complaint of chronic pain patients. And a lot of it is that neuropathic pain from a disc pinching on a nerve, running down the leg. It's the #1 reason cannabis patients are using medical cannabis. So let's talk about pain and cannabis and refresh us, Blake, on why cannabis is helping.
Everything in humans is derived back to the fight or flight response and survivability, right? And our systems, though, are really good at being able to differentiate a lot of things. Most of our pain receptors and so forth always trigger a central nervous system, sympathetic nervous system response that includes epinephrine, immune system response, and this fight or flight mechanism that occurs with pain. And so, as a result of that, you start winding that system up and you have all of these effects from doing that. And then you have to wind that system back down. What cannabis does in terms of like Delta-9 is you mask a lot of that wind up process. And so you're not as aware and you don't have a lot of the same pain responses that you would have of being in pain because of masking.
Really just that psychoactivity, putting your pain over there on the couch.
Yeah, it goes on the couch. We're not going to worry about it.
Is it dosing dependent? And Kylee, have you noticed that pain, especially with back pain or this really musculoskeletal pain, strong pain, is really dose makes a lot of difference with cannabis?
It can, though sometimes I wonder if they're just not getting the correct cannabinoids. And so they're looking for that higher dose of THC because they're not getting enough CBG or they're not getting enough CBD along with those types of things.
Interesting, because a lot of patients will come back to me and they'll say, look, I've just got to increase the dose of THC to get the effect that I need. And what you're saying is that there's more to it than that.
There's more to it than that because ultimately, so one of the things that I've heard as a critique against cannabis for pain is that, well, if you're just masking, it's not fixing the issue. But look at opioids.
Opioids don't do anything different than masking.
That's exactly right. But what Kylie's suggesting is, look, if we start adding CBD into the mix, we start adding CBG, we're actually going to have some anti-inflammation responses. And so you can lower that whole firing up of the whole synaptic system, of the whole central nervous system. You can actually start averting those, histamine responses or some of those other things that cause inflammation. And so by doing that, you're masking the onset, which is awesome because you're not in pain. But secondly, you're actually lowering inflammation and helping
the actual condition.
Actually helping the condition.
Kylee, do you have some products that are like, you go to these products all the time?
The 1 to 1 to 10 tincture from Zion. I think that is the thing I tell my patients to use the most of, especially if they're coming in for pain and neuropathic pain specifically, because it is so high in CBD. And you can still get plenty of THC out of it.
1 THC, 1 CBG, and 10 milligrams of CBD. So you're getting that kind of this entourage effect, but it's long lasting.
Yep.
The tincture is. And then do you layer like an inhaled method on top? I
usually layer in an inhaled form, and I like to have them use something that has CBG or CBD in it as well. And there's a lot of products that have that in it now. If we can get a Delta-8 in there, that's also great. That's usually really helpful for back pain. But I think almost every company that I can think of now has something that has some other cannabinoids in it now.
Blake, why does longer acting things work? Like, what is it about long acting medications? Okay, I'm answering my own question here. Long-acting medications are going to work better, right? They're more consistent.
Well, let me put it this way. So I have shoulder injuries. And so, I've talked about this before, but like even reaching for a shirt can hurt my shoulders, right? And so what I'll notice is if I'm taking medication every day and then I forget a dose, I can still raise my arm and I'm not in pain. And it's because I'm still getting these lasting effects of regular dosing at regular intervals, right? And so it's only if I then take a break for multiple days that all of a sudden, oh no, I'm in pain. And in the case of like CBD, it's a little bit harder because I'm not having the psychoactive change. So it's like, well, is it even doing anything? Because you're not getting this like, oh, I feel it working, but I can tell when I reach for my shirt in the morning,
It is working.
whether it works or whether it
it's
doesn't.
working. Okay, so let's
Right?
bring up, this is kind of a new concept in this whole video series that I'd like to bring up right now, and that's endocannabinoid tone. So there's more and more research that we're somewhat cannabinoid deficient because we didn't grow up with the cannabis plant. This is part of normal medicine for people, normal consumption. But increasing, there's this evidence that shows that if we can add a little bit of cannabinoids to the system, right, consistently, we increase that endocannabinoid tone. So like you say, when you miss a dose, it's still there. It's still helpful almost.
Right.
Just because you're, it's like working out, right? You're kind of exercising that homeostatic system. Is that, you feel like that plays a role?
Yeah, I mean, what I would say is, so I always am careful if we're going to say we're missing cannabinoids from our systems.
Yeah,
right?
I love to say it.
I know you loved it, but what I'd say is you have a typical way that your body produces normal compounds, and that's determined by genetics, a little bit by environment, right? But humans are different from what we used to do. I mean, humans were probably never designed to bend over and lift objects 50 pounds all day, every day, nonstop, right? Which means your natural, normal set of neurotransmitters that you have is not sufficient for what your daily activity is, right? And so before there was, 7 billion people on the earth, natural selection, unfortunately, weeded out people who were not able to do those types of things. Now we have all kinds of people with all kinds of things. And I think it's a beautiful thing. But what that does mean, to your point, is we now have to supplement things that your natural disposition may not have you be ready for your type of lifestyle or what you do. In the case of me, I was too active in my younger days, and now I'm suffering the results of that. So even if my body was geared in my younger days to do that, it's not geared to do it now. And so now I have more pain. Cannabinoids help.
We really want to get people off of their opioids.
Yes.
And pain, and like we said, back pain is one of the biggest reasons why people use opioids chronically. What's your advice to patients who want to start using cannabis for their pain, really to focus getting down their
opioids? Start so low. I have some patients that will start as low as 1 milligram of THC, and usually with the 1 to 1 to 10 tincture, so they still have that CBG and the CBD with it, because I want them to build up THC while they bring down those opioids, and then
build up
kind of
some tolerance to the THC so that they can bring down. So maintaining the same their same medications now, just building up a little bit of tolerance over.
And then working really closely with whatever other kind of like primary care provider that they have, or if they're working with a specific pain clinic, working with them really closely so everybody knows what's going on and no one's surprised if anything happens.
Right. A care team is so important for everything that you're doing, because whether it's seizure medications, PTSD, pain, whatever it is, don't cold turkey any of your meds.
Not any of it.
That's a terrible plan.
Please don't just stop taking your opioids.
But what we have found, what we've seen over and over again, is you start to increase your cannabinoid intake, you can, working with your primary care doctor and so forth, start backing off on these others. And some people are able to actually get completely off all their other medications over time. But
it takes time.
It takes time, and
it's work. It's a lot of work.
That's right.
When we're using cannabis for medication like, to replace opioids, talk to us, Kylee, about scheduling those medications and being consistent with those dosage.
So when you are trying to use cannabis for pain, you want to make sure that you're taking your cannabis on a schedule. You never want to allow the pain to get so bad that then there's nothing that we can do to get over that pain.
Right. You want to stay ahead of this.
We want to stay ahead of the pain. So scheduling it out, making sure that you're taking it on time, keeps you from getting those big highs and lows in your pain.
Yeah, and this is interesting because normally patients, we would just write the prescription, take this 3 times a day, and now you're having to educate patients to, no, you've got to make the decision to do this yourself.
And there are a lot of times where I'll work with patients and I do tell them, I want you to take this every 6 hours. And I'm pretty clear when I'm working with a patient how often I want them to take it depending on what their condition is. But I know that is not always happening.
Yeah.
And that's why the layering becomes really, really important, because you want this baseline that's always present. And so you're going to use pills, tinctures, edibles, other types of things that have this longer duration. And then you're using for immediate use inhalation methods and things like that. And so it reminds me of migraines and cluster headaches typically. Yeah. If you're into full migraine, THC is not going to help you.
Nothing's going to help you.
Yeah, you're in it. You're in it, and you're going to be in it until it subsides. Mm-hmm. But if you can feel one coming on, you can start doing intervention. And so this is why this scheduling becomes really, really pertinent, because it's pretty much the same for everything.
And setting realistic expectations, like with the migraines, and that this isn't going to be the thing that just turns off your pain altogether the first day you use it. Usually
there's not anything you can give a patient in cannabis or outside of cannabis in the regular prescription drug world that will take away your pain 100%. Right. That's not a realistic goal.
Sure. So but increased functionality, increased mobility,
absolutely,
increased satisfaction with life. Mm-hmm. That's really what we're going for.
And those are realistic goals.
Decrease risk of the prescription medications.
Yep. Yeah. Those are realistic goals. So to think that something is gonna take away your pain 100%, I don't think is very realistic. Sure.
But being able to pick up your kids or drive or go to work, that's realistic.
And not be miserable.
That's
all we could ask
something
for.
You can do.
Yeah. If you want a video about layering, I did a short little video about layering that we'll link here. I recently had a bout with back pain, and I mean, it took a lot. It took some higher dosing than I was anticipating, frankly. But my favorite strain for pain is Fatso. You guys grow it, and it's strong, and it took a lot, but that's hands down, that's my favorite strain for pain. My favorite product too.
For an inhalation method that's going to be flower, I think Fatso is really solid for that. Mm-hmm.
I know what you're going to say. Mad Max.
I like Mad Max. If you're going to smoke regular, right? You're going to build up CBG as a regular used flower. Yeah. I like Mad Max. I like working with your provider and working with the pharmacist, because sometimes anxiety and stress exacerbate your pain. Mm-hmm. So looking at a CBN product to lower your stress and anxiety can have a better effect for your other cannabis products. And so there's cool one-to-one carts. There's some really cool things out there
to try.
Yeah. And I'm going to plug Zion for 1 sec. Zion has all kinds of really, we have a 1-to-1 to 10 tincture that Kylee has mentioned for CBG. We also have a 1-to-1 to 10 with CBN.
I love that one. Yeah. The lavender one.
Yeah. And
then good for relaxation and sleep.
A 1-to-1 to 1 that's a vape cart for CBG, but we also have a 1-to-1 to 1 with CBN. I mean, there's cool cannabinoid combos. We have a lot of CBDV that we can add for enhancing appetite and some different things for cancer patients. Like the world is getting bigger and bigger in cannabis with all these other minors that we're using.
Yeah.
What's your products?
The products that I like are the 1-to-1 to 10 tincture. I use it all the time. And then the Heal You has made the Super Lemon Haze cartridge that we've had really good luck with a lot of my patients. They like it because they feel a little more uplifted, but it's more about working with the individual patient.
So personal.
It's so personal that it's hard for me to make a blanket statement that that cart's absolutely going to work for you. It's hard for me to say.
79% of our patients at Utah Therapeutic Health Center reduce the use of prescription medications or alcohol within the first 6 months of starting cannabis therapy. It's a pretty big statistic.
Yeah.
And so working with your provider who knows a little bit about cannabis, who knows about the medications you're prescribing, working with your pharmacist at the cannabis pharmacy, and picking good products made by quality manufacturers who are testing their products and who are really building products like this tincture that are specifically designed for people with pain and people with medical conditions. In the comments below, if you have a favorite product that you're using specifically for back pain, or you have reduced your opioid use, we really want to hear about those stories. They're important to help other people destigmatize the plant. And if you want more information, you can go to utahmarijuana.org/guides, where we have a detailed guide on how to start using cannabis with opioids to decrease your opioid use. I'm Tim Pickett for Discover Marijuana. I think this has been a good episode. Thanks for watching.